Hello and welcome to this month's Community Transformation webinar. Thank you for joining us today. Just a little bit of housekeeping before we get started. Because this is a pre-recorded webinar, if you do have any questions after watching it through, please do send them through to us at communitytransformation@spft.nhs.uk. What we'll do, we'll then bring together all the questions that are received into a grid with the answers, and we'll then send them around to everybody who had registered to attend the webinar last week. And we'll also make them available on the Community Transformation web pages so that everybody can see what was asked and what the answers were. Obviously, because this is pre-recorded, it is recorded, but we're also going to make this available on the Community Transformation YouTube playlist so that you are able to watch it back again. People that weren't able to tune in can also watch it back. And obviously, please do share the link with others who you think might also be interested in watching it as well. Everybody who'd registered to attend the webinar will be sent round a summary and just some additional information of the information that was covered in the webinar today. So you'll receive that, so do have a read through. There's also going to be some more information there around our networks and the Transformation Ambassador programme. So do have a look at that and get in touch with us if it's something you're interested in. There'll also be a link to a very short survey which we circulate round after each of our webinars just to find out whether it was useful for you, if you've got any feedback or comments about how we could make the webinars even better. So if you could spend a couple of minutes just doing that, that really helps us to make sure that these are really helpful. And lastly, as I said, we've got a playlist on YouTube of the webinars we've done so far. If you scan the QR code that's on your screen, it will take you to that playlist, and this webinar will also be added to that shortly. And I'm now going to hand over to Rachel Coffey, who's going to lead us through our presentation today.
Thank you, Megan. So for those of you who don't know me, I'm Rachel Coffey and I'm the Transformation Director for the Community Mental Health Older and Adult Transformation. As Megan has said, this is a series of webinars as part of our communication strategy, and we are trying to kind of build knowledge as we move forward. So really would recommend, if you haven't already, to look at the November and December webinars, because they kind of building those kind of building blocks of knowledge. So the first one in November was a real basic, this is what the transformation is and what it's trying to achieve, and also trying to kind of list out some of the benefits and what will feel different, so that people have got kind of real fundamental foundation understanding of what that is. And then in December we had a fantastic presentation from Jenny Edge and Anne Foster around the EWS service, which I'm going to touch on a little bit in a minute, but it really gives a really detailed view of what that EWS or emotional wellbeing service is all about, and it really is the foundation of the transformation. So I would definitely encourage you to go back and have a look at that, encourage your teams to as well, and encourage as many people as possible to come to the webinars, because it's really about how we engage with you and really get the understanding of the transformation, really far and wide. And also we'll talk a little bit more about the Transformation Ambassadors Programme later, as we alluded to, but about how we really get that kind of that information coming up as well, about what you need to know, what you would like to know, where the kind of anxieties are, because it's really important that we shape this communication for you. So so we'll talk a little bit today about what's happened so far. I think we know that this is a huge programme of transformation, very much about transformation, working very differently at the end of this transformation. So really trying to give you an illustration of what's happened over the last couple of years, and also what's going to be coming up next, just to give you a bit of a better understanding, so you can see the progress that we're making, which I think is really important. And there's been an awful lot of hard work from all of the teams in very challenging circumstances, as you all know, to really drive this programme forward. So in terms of the emotional wellbeing service, as I've said, this is about the foundation of the service, and actually it's built at a kind of PCN level, and really, it's meant to be, providing that service for people with SMI, or serious mental illness, who at the moment, fall in the gap between IAPT and secondary services. So it doesn't replace IAPT, it's just that kind of next step for people to be able to be held at a primary care level and access some of the support they need, not just from mental health kind of clinical, but also about how we can link people in with the community, how we can find support for them there. and we have made significant progress in this area over the last 6 months, especially. So we now have 18 mental health practitioners working at a PCN level across 17 PCNs in Sussex, and also 34 mental health support coordinators who are our VCSE workforce, who are working with the mental health practitioners and supporting them at a PCN level. So I think, in the kind of nationally, it's a challenge to find roles. There's a lot of, the band 6 mental health practitioners don't grow on trees. Nationally, there's a shortage of that level. So I think it's been really great to see this level of focus on what we've been able to achieve in a very short time scale in terms of starting to really make a difference in this area. So we're continuing to roll this program out, but actually you can start to see that this is, and obviously go back and watch the webinar. I think it'd be really helpful, gives you a real understanding of how this works. So, but actually it's a really good foundation to start integrate and work differently, because the transformation is about how we work differently together in a more integrated way around the needs of our community. And also, we very much want it to be a much better working experience for our staff as well. So we'll move on to the next slide. So just really wanted to talk a little bit about the impact that this is having, because I think it's really important to try and bring these things to life and show what a difference this is making already, even though we've only really, we are building this transformation in an iterative way. So I just wanted to read out a couple of comments. We've got a lot more of this, but it gives you an illustration of the impact that we're making already. So I was so thankful when they offered your service when I called to speak with a GP, to be then offered a next day appointment. It couldn't have come at a better time. I am thankful for the time and effort you have put into me and my mental health, and how you have changed my life and made me realise there's support out there for me. Thank you. I feel really positive about things at the moment. I feel that what we have worked on in the sessions together has really helped me to look at things in a different way. I also feel confident about being able to access support and know who to talk to when I'm feeling down. So I think that really gives you a flavour of the benefit that these roles are already starting to have and making a difference to people, and also that people are able to look at and access support and know who to talk to as well, because I know that's a big challenge and one that we're trying to address as part of the transformation. So the next areas that we wanted to talk about a little bit was about the kind of what we call dedicated services, I guess. We have made lots of progress in the rehab services, community rehab services, eating disorders and complex emotional needs. Initially, in 21, 22, we were very much looking at levelling up services. So to try and make sure that we were starting at the same foundational level in each of the different places. And when I refer to places, I mean Brighton and Hove, East Sussex and West Sussex. So a lot of that was making sure that we brought everybody up county-wide with a very similar offering, because obviously we want to make sure we're addressing health inequalities. But as we look to integrate our services further with emotional well-being, it's just making sure we've got those good foundations to do it from the same level. So to give you an example of some of those areas of success, we have stood up 2 new hubs in Worthing and Bognor Regis for the enhanced community rehabilitation service. This provides intensive community for treatment of adults with high complex needs, psychosis, for example, and really works closely with the community rehabilitation teams, inpatient teams. This has been really co-produced with service users and people with lived experience. And I think from our perspective, the transformation is so much about co-production. It's about working with our partners, our VCSE partners, our local authority partners, but also with our carers, service users and peers as well, around how we do this and how we provide a service which is right for them. And it's such a key kind of component of the transformation. And we'll talk a little bit more about how we incorporated that as we go through as well. But obviously these new hubs are great, and we're also looking to potentially have one as well in Northwest Sussex. So that would be kind of another next step. But this is really kind of leveled up services that we've in West Sussex with the rest of the county. Then in terms of eating disorders, we've got 15 additional posts in East Sussex. So we've expanded that service to align with the rest of Sussex. And actually we now have a open age steering group. A lot of this work had been actually worked on at place level, but now we're really working and we've got dedicated steering groups stood up to work across Sussex on our development of services and pathways collectively together, so that we actually have a very clear kind of model at a Sussex level. Of course, it will be flexed to the different health inequalities in different areas, but actually how we work collaboratively together across the patch to try and address that and make sure we've got no unwarranted variation. So we also now have an open age steering group for ED, for eating disorders, because a key requirement of the transformation is about having open age access to eating disorder kind of services and ageless service across Sussex. So we're working really closely with our children and young people colleagues together to provide that service. So we're now starting to really join things up. And then in complex emotional needs, we've added 10 additional psychology posts into West Sussex, but also 40 clinical staff in West Sussex have received specialist training in evidence-based therapies in January. So we're starting to do more training, and actually we're trying to develop that, as I said, those pathways for all three areas across the patch in Sussex to build on the work that we've done with levelling up services in each area. So the next slide. So access facilitators. So access facilitators are a really key component of our reaching out to people to get them to come in for their physical health checks. So the access facilitators are part of the emotional wellbeing service. We've now got 18 of them involved. And I think just to explain to you how that service works, it's very much about outreach, using the GP SMI registers to get people into GP surgeries to have their SMI physical health checks. So they work very closely with GPs, and actually sometimes they'll do some of the health checks and other people will do other parts of it within the surgery, but it's very much about linking with those people, starting to build a relationship and bringing them in order to have their health check. So we've managed now to recruit 18 access facilitators, and that's predominantly been over the last year. So that's a real success, and it helps identify health issues earlier for these people. We know that that mental health and physical health needs are so intrinsically linked, and we know that people who tend to suffer from those kind of areas definitely have a shorter lifespan. So of course, really what we're trying to do is address the health inequalities, address some of these groups, and really make sure that we can provide a better experience and outcomes for our population. So the screen to intervene workers, these guys work directly with the access facilitators, and they're part of our VCSE or voluntary sector community staffing, and they are really working then that next step. So when they've had their physical health checks and they've got the areas to work on, the screen to intervene worker will work directly with them to come up with a co-produced plan that they work on together, so that will allow them to access groups in the community, have a holistic plan for themselves to really deal with some of their kind of physical health needs and also their mental health needs as well. So we've now fully deployed that service across Sussex, and we've got 3 screen to intervene workers in West Sussex, 2 in East Sussex and 2 in Brighton and Hove, and we've received 180 referrals so far. So these are really key areas that we're trying to kind of really build up this kind of workforce, and the next step's very much about how we get more collaboratively together. Obviously we're working in that kind of emotional wellbeing service, but how do we work with our CMHT colleagues? How do we work more kind of holistically across people's needs and work together so that we're making sure people don't fall down in the gaps? And also, so another area of levelling up was around enhancing our core community workforce, so our CMHTs. So we've added an additional 31 roles into those teams, including neurodivergent practitioners, dual diagnosis practitioners, assistant psychologists, occupational therapists, and clozapine clinics. And they're just some of them, but just to give you an idea of some of the additional roles we put in there. But that's to really bolster those teams and therefore be in a great place to start working more collaboratively together. So on the next slide, so other areas as well. I mean, we've got a really vibrant voluntary community and social enterprise network in Sussex. We're working really hard with that group, and we have VCSE transformation leads who work with us every day on our program, which really kind of builds those relationships and works closely with our VCSE community, because we've got a vibrant community with over 600 different VCSEs within Sussex. So, and key component of the program is about working with VCSE more, and actually also widening our the scope of services that we provide, and using more of that VCSE services as well. So I'll come on to a little bit more about some of the areas that we've shortly about the VCSE. But one of the things that we have done is we have, through Heads On, we have administered a grant fund of £475,000 into really to drive working with smaller VCSE and working with people in the community to against the objectives of both suicide prevention and also the adult community mental health transformation. And this is really to expand on the work that we're doing, but specifically looking at areas of inequality. We've got lots of areas within Sussex that have got health inequalities, and we're sort of really singling those out and actually singling out some of the objectives that we have around the programme. So until now, we have allocated £220,000 worth of the grants. It's through 3 different funding streams. We've got Innovate funding stream, a Build funding stream, and a Grow funding stream. And the Innovate and Build, we have already gone out for one. We've already been out already, and we're going through a second process for the Innovate and Build pots of money. So that's finishing shortly, the second phase of that programme, and then we're shortly to open the Grow phase. So I would suggest if any of you are interested or not already engaged in this process, that you, if you go to Heads On, they will be able to give you some more information about what the requirements are of that. However, it's a really great way of making sure that we're linking in some of our smaller partners and actually really looking at the objectives and what can be done in the community. So we're really excited about the outcomes of some of these, and we're seeing some really great kind of projects coming through, which are really exciting. And then we have got obviously communications and engagement, which is a key part of transformation. Every transformation is really making sure that people understand what we're trying to achieve, what their part in is in it, and also how they can be how we can be involved and understand what the benefits are of this. Because I think, from my perspective anyway, the transformation is about the hope for the future. We know it's been challenging financially across the system. We know it's been challenging with certain areas being in business continuity. You know, it's a real challenge for that perspective. But this is really about the hope, about how we work together differently moving forward to make sure that we can really address the needs of our population and our staff as well. So we've launched this monthly webinar. Of course, this is one of them, to really try to engage and build people's knowledge. We've also got a monthly newsletter. So if any of you can encourage people to be part of that, that'd be really helpful, to just make sure we can sort of send our information out far and wide to all of our different partners, really trying to educate as many people as possible about what we're doing. We've relaunched our social media presence on Twitter, Instagram and Facebook, so we'll come up with some more information about that towards the end. We've also got a landing page now on the new Sussex Partnership website. We will be building out on other areas as well, but that's a really good first start. And we've launched the Transformation Ambassador Programme. So this is a network of change champions. I'm going to talk a little bit more about it later, but it's really about having that network of people to communicate to outwards, but also to kind of really help us understand what the needs and wants and how we shape this communication moving forward, especially as we know we've got multiple different audiences with multiple different needs and needs of levels of understanding as well. So we'll talk a little bit more about that. But it's communication and engagement is a key part of what we're trying to do much more effectively moving forward. So just to talk through other areas that things that we've been doing. So in August, we had 2 system-wide workshops. So this was really looking about how we kind of prioritise, work out what our system priorities are, as we've been working on lots of the different areas, how we bring it together and work on what our next steps are. So they were well attended by across the health and care sector, experts by experience, carers, and also lots of different kind of people across the system coming together, and actually was really not just co-produced but co-led by experts by experience and the rest of the team. So it was a really great couple of days, really looking at how we move these things forward. Following on from there, we had place-based workshops. So in East Sussex, Brighton and Hove and West Sussex, they had their first workshops in the autumn, in October and November, which was really to take what we'd learned from that experience and also bringing people up to speed with what the transformation was, and then starting to identify actions that they want to work on from a place-based perspective. So really importantly, one of the things that I wanted to just explain as well is because of the size of this transformation, because we need to continuously develop and continuously learn as we go along, we've started with kind of 3 different areas in each of our places. So in Brighton and Hove, because it's small, or smaller in terms of its footprint, we have they're working collaboratively together as a integration site across the board. In West Sussex, we've got Crawley, and in East Sussex, it's High Weald, Lewis and Havens. So they are what we're calling first wave integration sites. So if you hear that term, that's what it means. And really, it's about starting to develop this ways of working differently together. And it's not, we want to make sure that everyone's involved. And certainly West Sussex have reached out to broader to really talk about some of the things that they're looking at. But this is about trying to make sure that we can contain that kind of geographically to start with, to work on things and then roll things out, learn as we move forward, and change things as we need to, as we kind of roll it out across Sussex. So, trying to do it in a kind of iterative way, because of the size and scale of this is large, and we just need to make sure as well that we can kind of work on things and then start to roll them out. So these workshops were undertaken around 4 key principles for Sussex. So about in 2021, there were some workshops to identify some of the kind of principles that we wanted to do in line with the principles of the transformation, but what are the things that we really wanted to design our services around. So the 4 different principles, just so that you're aware, were around personalised and complete care. So making sure that people are treated as whole individuals and in charge of their own care. So essentially no decision without me is the kind of area that we really want to focus on. So we empower people to self-manage, but also give them real clear understanding and signposting about the options that are available to them. So the key component again of the transformation is about this model being driven by need and not criteria, or by diagnosis. So we really need to make sure that we're incorporating some of the physical health and impacting social factors. So holistic view of someone's needs, which could include finance and different other areas as well, which could be causing people kind of mental health challenges, as we know, especially in this environment at the moment. How do we really look at that person and look at their holistic needs and actually devise their plan with them? So that's a key principle of what we want to do. Simple and seamless is the next principle, and it's really about saying this really needs to be easy to navigate. No matter where people come into our system, we need to be able to ensure that their needs are met. Our services are going to be much more integrated in moving forward. We know that there are lots of gaps currently in the services that we provide, and actually it doesn't help our population at all, because they often get lost in the gaps. So actually that kind of seamless navigation between primary care all the way up to inpatient care if it's required, but also help, really importantly, backstepping people back down and holding them in the right place for them at the time. Really, really important. Also, we hear a lot as well about people wanting to state their needs only once, and having to do that multiple times. So that's a kind of key principle about what we want to do, although we know that there are severe challenges around some of the data and the interoperability of systems, but obviously that's something that we want to work towards. Accessible and inclusive, this is about high quality treatment and support delivered in a range of welcoming, convenient and therapeutic environments as close to home as possible. And that's really why, it really needs to be driven by the community. And we've talked a little bit about what we mean from that and some of the requirements and objectives of the transformation, but actually working more closely with the VCSE and advancing equalities and meeting the needs of local communities, because we know each community is different. Even though you need to have a consistent way of doing things, you do know that you have to flex for individual areas because we have different needs and different populations. So that's a key component of what we're doing. And then one team, I think we feel very strongly that this this is one of the most important parts of what we're doing. It's about culturally how we work together differently and how we support each other and how we provide shared leadership across the patch, because it's going to be a different way of working. It's exciting because I think, it's going to lead to real improvements, but actually it minimises duplication. We look at how we manage people more effectively and we maximise the resource that we've got, because again, focusing on people's outcomes. We want people to be better. We want people to, and we want our staff to have a better experience as well, and really focus on retention. So these are kind of things that we really want to focus on, about how we work differently together and how we're one team, which is kind of part of the challenge of bringing multiple organisations together, and working in different ways. So from the workshops, we kind of had 6 priorities that came out of it from the system workshop. So they were the initial ones. Model design. This is about what does our new model of working look like, and how do we deliver, and what we're delivering to our service users and carers. So so that is piece of work that's underway. EWS, of course, is the foundation, as we've mentioned, but actually how we kind of move that forward, and we're talking about that in some of the next steps. Governance and leadership. A transformation, it needs to be led from the top. It needs to be led by all of us. It's a huge undertaking, but actually has to be led and owned by us all, in terms of how we move forward and how we work together in a different way. And we're providing governance structures, and we just have to make sure we have the right, we do have the right governance structures to make sure that we can make decision making easy, and also kind of move at the pace that we really want to. So that's one of the areas. Workforce. We've talked a lot in the previous slides about additionality, so using transformation funding and investing in new roles, but also this is not, this is about how we work differently together and how we look at the totality of the workforce that we have and how this now needs to work differently. So it's not just about additional roles, although that's been a key component that we've been working on. It's also about how do we work together differently moving forward, and how do we provide a really fantastic environment to work in and make sure that we're providing roles that people are happy and really feel supported. So that's a key component of what we're doing, a very large part of it. Then we've got data, digital interoperability and outcome measures. So sounds a bit dull, I know, but actually being data driven, understanding what our outcomes are, understanding what we want to challenge ourselves as Sussex in terms of better outcomes for our service users, for our staff. But also we know we have challenges with systems. We know that digital can play a big part in the transformation. So these are all areas that need individual focus as well, and make sure that we have data to really drive our decision making. Comms or communications. This is a really kind of vital part, making sure that people know what's going on, understand what's going on, understand the direction of travel, and are really clear about why we're doing this. So we are really focusing on making sure that we've got that, and we're setting up a lot of structures, as we've talked about already, to really make that the best of that. And then finance, that's a kind of area as well, about making sure that we're investing the money that we do have in the right areas to provide the best possible care for everybody. So when we did the place-based workshops, what was interesting to see was that we saw a lot of consistency of the things that are coming out. So, for example, the first thing that's really clear on there, if you go to the next slide, next part of the slide, Megan, is the integrated wellbeing hubs. So mental health hubs, develop wellbeing hubs. So very much about how do we bring together the service, either in person or virtually. It will depend on the location. It will depend on what this looks like. However, about really providing a service in the community for our community that's closer to them, with the right people that can help them, working in a multidisciplinary way. So that is one of the things that came out of the first of the workshop. Secondly, was about awareness and access to services, improving local understanding of services, digital directory and referral portals. So very much about understanding what we've got already, because there's a huge amount of help out there, especially within our communities, but people don't necessarily know where to access it, how to access it, that exists. And that includes, in the workshops, it was very, GPs not knowing that some of these are available. So we need to do a big piece of work to really make sure that people people are aware, and actually how we as well, not just our population being able to understand what's available to them, but actually how we help people navigate the services that are available to them, especially in the community and at a PCN level before, so that we can really try and hold people at that level and give them some of those services so they don't end up moving down towards secondary care or inpatient services. And then the last one was just around networking and building relationships, multi-agency access points for assessments, system-wide triage, smoother transitions between and away from services. So very much about how we build those teams, how we build the relationships, how we triage people and manage them in a multi-agency way so that we can provide them their kind of holistic level of support right there. So we'll talk about some of the next steps here, but we are bringing these together and prioritising the different areas. But it's interesting and good to see that we're seeing very similar priorities coming out of the place-based areas as well. So how are we working together? So we have what is called an integrated community mental health steering group. I know it hardly trips off the tongue, or ISG, but this is around how we, at a system level, provide system-wide support, oversight, guidance, and leadership across the 3 places. So Brighton and Hove, West Sussex, East Sussex, as you can see, are now really starting to work at pace around their first wave integration sites, but we need to make sure that we don't have unwarranted variation. So it's actually how we bring everybody back together and work on the priorities there, but also work on some of the system-wide priorities, for example, assessment, referrals, triage, which need to be done once and in a consistent way. We can't have 3 different ways of doing the same thing. There are some things that absolutely have to be agreed at a system level and then delivered at a place level based on their inequalities. So membership of that includes Sussex Partnership, VCSE, local authority, integrated care system, commissioners, and also lived experience. Very, as I say, really key to have local authority, the VCSE and the lived experience on our central governance structure. So it's really about how we kind of make sure we've got updates and we know what's going on, but also how we design some of the system level pieces of work, and that's where that's the place that happens. Also, we've launched networks. So we've got VCSE mental health networks in West Sussex, East Sussex, and Brighton and Hove. Some of those are building on kind of existing networks which were there, but also, and actually some of it's about launching ones. And that's really about providing opportunities for organisations or VCSE organisations of all sizes and capability to play a part in the design and delivery of community mental health services across Sussex. As I said, VCSE is a key part of how we do things differently moving forward. And these are open to every organisation that deals with mental health of people, both indirectly or directly. So we have key transformation leads, as I mentioned before, for the VCSE working on this programme. And to access that, if you want more information about it, then you can do that through them, and we'll provide information as part of the pack so you know where to go. But these guys are really key as part of those kind of that link in, so that we've got one voice from the VCSE and making sure that we're taking into consideration their requirements. And then we've got the SCALE, or the Sussex Co-Production and Lived Experience Network. So this is bringing together people with lived experience who have desired to make a change to the mental health care services in Sussex. It provides a place for people to have their say in the development of the mental health services, but it also aims to unite the different lived experience groups that are out there to provide more consistency and unity. And actually that's unity of voice. So that's very much about the VCSE mental health networks, and also SCALE is really trying to provide that that kind of unifying voice at the centre of the programme as well. And actually our next webinar focuses on the lived experience peers and carers and network. So we're going to be doing that to talk about that, because it's a really vital part of our transformation. So transformation ambassadors, so who are they? So it's really a group of people who are engaged and enthusiastic in the community transformation programme and want to help to shape the future of it and the services. So we've had a kick-off meeting initially just to talk about this. We've had people putting their hands up already and putting their names forward, and we'd very much encourage you to do that from wherever you are in the system. This is really important for us to be able to do that. So we are making sure that this network is about informing people about the programme and building interest and enthusiasm. This is a really exciting opportunity, and I think, you know, this is something that we really want to build excitement with and, you know, really build the knowledge, but also it's encouraging other people to get involved. It's bringing concerns and issues back to us so that we can help kind of really structure and feed into our communications moving forward. And also moving forward, it will be taking part in workshops and events. So we've got our first kind of official meeting in February. We really want to make sure that we're actually reaching out as well. So we've obviously got people coming and asking, saying they want to be an ambassador. You know, we really want you to do that. But we'll also be looking at where we've got all of the different areas and reaching out to some of the areas where we might not necessarily have representation, because it's really important that we've got that network across our system, because it's a really key part of really engaging people and communicating, making sure we're communicating the right messages. So if you want to get involved, please will you email the community transformation at spft.nhs.uk to find out more. We realise that people are very busy, so, you know, in terms of time, you can get involved or not as you want to, but it's really important that we've got people to champion this out there, and really excited about this. And we've got the VCSE and Scale network leads as transformation ambassadors as well. So this will be really intrinsically linked into the VCSE networks and the Scale networks as well, because we want everybody's voice as part of this. So please reach out if you're interested, because we'd really like to build that network and get you along to our quarterly meetings. Okay, so next steps, just to talk a little bit more about what we're doing, and I've mentioned quite a lot of this already, but, you know, we've got the EWS as our foundation. We're now going to be starting to develop our cross-sector integrated multidisciplinary team or multi-professional team. You know, how do we work together differently, and how do we start to bolster and work and link that EWS service to the rest of our community mental health teams and beyond? So next is to really, as we mentioned, identifying the common priorities. You can see them from the place-based workshops, and then working on the priority areas in a collaborative way together and taking those forward. Continuing the rollout of EWS, as we said, we've got 18 mental health practitioners and 34 mental health support coordinators. So, you know, really continuing to roll that out across Sussex and transforming the current teams in line with the objectives of the transformation. There will be a new clinical lead to provide additional clinical leadership across the system in place. Not here yet, but that will provide a lot more support from a clinical perspective and bringing things together, working with an SPFT, but also working closely with our system partners as well. Developing system-led products, not particularly exciting name, but things like I was saying, you know, need to be developed and led at a system around assessment, multi-agency triage and referrals. So we're starting to work on some of those different areas. Building on our VCSE partnerships, building on those networks, as we've talked about, and the future funding grants, but also looking at innovative contract models. We know that it's sometimes challenging in terms of the contract mechanisms that we have actually across the NHS and in governmental areas in total. You know, the length of contracts is often a challenge, you know, really being able to look at your strategy and building your teams. So that is definitely an area that we're trying to focus on as well, about how do we make that a better experience. Continuing our communication strategy for the programme, really driving and building relationships and identifying transformation ambassadors across all different areas to be working together. Using a trauma-informed approach, which is very, again, key component about the transformation is always through a trauma-informed care lens. But we really want to explore the language and terminologies that we use within our services. So that came out strongly from our system workshops as well. And we're developing a proposal for how we start to discuss new language. So there will be more details about that shortly, but we really want our language to be inclusive and non-stigmatizing. We can learn from other areas that have done this across the country, certainly from the early implementer sites who've done this, and also, you know, really wanting to make sure we do this through a trauma-informed approach. So we'll be running some workshops about this. So if you want to get involved again, please let us know. And you know, evaluation, so creating an evaluation framework that monitors progress against improving outcomes for our population and staff. It really comes back to about holding ourselves to account, making sure that when we're investing this money, when we're changing our services, that the outcomes of our population and our staff are at the forefront of our thinking. We we need to be able to monitor progress. So as we make changes, having an evaluation framework says, are they making the differences we're expecting? Because we need to really think about that and about how we evaluate along the way to make tweaks to it if things aren't doing what we're doing. But also the whole point about the transformation, even though we have NHSE requirements for improving outcomes, we need to really charge ourselves as Sussex, saying, actually, what do we want to see and how do we want to improve and how are we going to measure that? So that is a huge undertaking. Also, data is always can be quite challenging, but certainly a lot of areas are being focused on right now to try and provide that information. So that is something that will be worked on as a next step as well. So as we mentioned, the next webinar is on Wednesday, the 15th of February at midday. And this topic is about working in collaboration with people with lived experience, peers and carers. So really would love you to sign up to that, encourage other people to sign up and also to watch the previous webinars. But obviously this is actually, as I said, such a key component of what we're doing and how we're doing it. So a really vital part of the transformation for you to understand a little bit more about. So I will now hand over to Megan. We'll just talk about any questions and some of the social media areas we've got. So Megan.
Thanks, Rachel. So just a reminder that we are taking questions off the back of this. So if you have watched this and thought, actually, there's something I really want to ask, please do send your questions through to communitytransformation@spft.nhs.uk. As I said at the start of the webinar, we'll bring all that together and we'll share all the questions and answers that we get through for this particular webinar with everybody who had registered already, but also on the Community Transformation webpage, so that everyone can read through it and hopefully find it really helpful and informative. We have also just got a little reminder about where you can continue to find out about all the updates in the programme. So the best place to start is the Community Transformation webpage, which is on the Sussex Partnership website. And on there, there's kind of a running activity log of everything that's happened so far and what's coming up. So that's where you can find all the details about the previous webinars, the upcoming ones, other events and workshops. And also right at the top of the page is a bright yellow button where you can subscribe to the monthly newsletter. So if you haven't already, do go and do that and encourage everybody you know in your teams, your friends, your families do the same, as it's a really good kind of one-stop shop to find out everything that's been happening within the programme and also those opportunities where you can get involved as well. And also give us a follow on social media. So we are on Twitter, Facebook and Instagram at Sussex CMHT. And our VCSE colleagues have also got a really great Twitter presence at VCSE MH Sussex. So do go and give both of those channels a follow and keep an eye on our hashtags so you can stay up to date with everything that's going on. And as Rachel said, do sign up to come and join us for the next webinar on the 15th of February. It's going to be a great one, hearing from our co-production leads and speaking about all the work that we're doing around working with people with lived experience, carers, and really making sure that our transformed services are exactly what our communities need. So yeah, do come along and join us for that one. Thank you for tuning in today, and we look forward to seeing you again next time.
Thank you.
Thank you.
Bye.